What is your name and position title?
My name is Debbie Cermack, and I am referred to as a cardiac sonographer.
Do you mind describing your career journey as to how you got to this position?
When I was very young, I was probably 7, 8, 9, 10 years old, I wanted to be an elementary school teacher. I loved being around kids. Unfortunately, when I turned 14, around that time, my dad passed away. And long story short, they ended up doing an autopsy and they found out that his cause of death, he initially had died from a heart attack, but underlying he had organ failure, and the organ failure was actually due to the fact that he had lymphoma cancer. So in coming here to Moffitt, I feel like I've come full circle. I was interested in the medical field after that, and when I first started out, I became a medical assistant. And the cardiologist that I worked for actually did his own echoes, and he would have me come in after I took care of patients after doing vitals and blood work and things like that, and I'd watch. And I thought, you know what? I want to do this. It was just so cool because there's so much information derived from this. So I went to school at night at Hillsborough Community College, and at that time it was a 14-month program. I didn't get an AA degree or anything like that. Some other cardiologists, pediatric cardiologists, helped me get a job at Tampa General. I worked at Tampa General for 3.5 years, learned so much. I actually got to go in for open heart surgery. I got there at Tampa General back in the 80s when they first started doing the heart transplant program. And I was able to go into the OR, scrub in, took a transducer similar to this, the machine was much older, and actually was able to put my hand on the human heart, the physical human heart, and do the echoes, which to me blew me away. I was scared about going in the OR initially, but it was just the coolest thing that I ever learned. So it was one of those things that kind of built upon itself, continually being, the medical assistant, then going on to do cardiac ultrasound. And it's just something, I don't feel like, even though I've been doing this for 37 years and been at Moffitt for 29, I'm constantly learning. There's new information. I went to a meeting last night. We used some enhancement agents to help improve, to be able to see the heart. And I learned a couple things last night. Even though I've been doing this as long as I do, there's always a chance to learn and expound on your knowledge and use it in a different way. So,
what skills do you believe are necessary to be successful in your position?
I feel like you need to be open, willing to learn, willing to try different things, be able to work with a group of people, but also work independently and individually, and also be comfortable with researching and not being afraid to ask somebody for help or, what do you think about this? Because, like I said, it's a constantly learning thing. We're seeing things that happen and occur that can be congenital from a baby and maybe not discovered till somebody is an adult. And so it's just, to me, it's a wide open field. So you just have to have an openness, a willing to learn, and not be afraid if you've done something wrong to correct it.
Why do you work at Moffitt?
I was able to be hired here, started here, and like I said, I've been here 29 years. I love what I do in regards to being able to be with patients, being able to talk with them. Sometimes these patients, they may say things to us that they may not say to anybody else, that they're afraid to say, or fears and things like that, or just talk about life and joy individually, or if they want to cry, I'll cry with them. I'm a good crier. But to me, being here at Moffitt is just, it's wonderful knowing that I can help somebody, even if it's a little part in the big picture, it's a big thing.
Do on a daily basis as a cardiac sonographer?
Primarily, my day is spent with doing patient care. The highlight of my day in working with the patients is actually the time that I'm spent with the patient. Usually, it takes about 20 to 30 minutes to do a patient's echo. Sometimes it can be a little longer, sometimes it's a little less, because not all patients are able to cooperate, lay down, and things like that.
As a person part of the medical field, what do you think is the most important thing kids our age should know about pursuing a career in medicine?
I think you need to be open to a lot of different things. Because truly, when I first started out working with a cardiologist, I was not happy that my clinical was in a cardiology office with adults, because I thought, okay, if I'm not going to be a teacher, I want to do pediatrics. When I went to Tampa General, I did adults and a lot of pediatrics. And the pediatrics, for me, was just so sad because, here is a newborn baby that's addicted to cocaine, or a newborn baby that only has half a heart, and all these. It was a personal decision because I didn't feel comfortable doing that. But then I have people tell me all the time, I can't believe you work with cancer patients and have been there this year, or this many years. It is tough. I can't lie about that. And there are going to be times, if you're truly into doing it and your heart's in it, you're going to have sad moments, but then you're going to have fantastic moments too.